You get so miserable. You don't want to be like this. It's hard to get through it. But with the bridge device, this is such a ray of hope.
It's not how good people think they feel while abusing opiates that keeps so many addicted. It's how terrible they feel when they try to stop. Pain, anxiety, vomiting, and diarrhea are some of the withdrawal symptoms that can last for several days when someone stops using opiates.
Your body and your nerves are on fire, essentially.
But those symptoms can be extinguished at INSynergy, a St. Louis-based addiction care clinic where the road to recovery comes with a bridge. What is the bridge?
The bridge is a remarkable device that allows patients to transition through the acute phase of withdrawal.
What this provides the patient is a comfortable way to get completely detoxified from opiates.
The bridge and a similar device called ST Genesis are both offered to patients when treatment starts at INSynergy. The device is worn on the ear and uses very small needles to send faint electrical pulses to particular nerves related to the unpleasant side effects of opiate withdrawal. INSynergy was an important participant in the study that persuaded the FDA to clear the devices for opiate withdrawal management.
Our body is governed by chemicals and electricity. When you use opiates for a long period of time, these signals become dysfunctional. What these devices have been able to do is go into and penetrate those highways and interfere with those signals.
It allows for patients to successfully transition because they are much more comfortable with the transition.
The bridge device, it's so amazing.
Sue got the help she desperately needed to beat her severe opiate addiction at INSynergy. The first treatment she received was the bridge.
My stomach is in knots, my legs are jittering, and I'm sweating. He puts this bridge device on me, and within 20 to 30 minutes, I'm not sweating. My legs stop jittering, and I thought, wow.
It works almost immediately because electricity, it goes straight in. Within 60 minutes after applying the device, we see almost 90% reduction of the symptoms.
It's not just, let's just put this thing on your ear and then look at you, you're all better, hocus pocus. Still got to go back in and you got to do the talk therapy.
This would be the first phase. After detox, that's when the work actually really starts.
That work can include talk therapy, family therapy, use of anti-craving medications, and even genetic testing to look for medical conditions contributing to a patient's addiction. But none of that can start until the patient goes through detox. And getting past that formidable roadblock is a lot easier when it involves a bridge.
The bridge device, it's a huge game changer.
For more information about INSynergy, including a no-obligation free individual assessment, go to INSynergySTL.com. Reporting for INSynergy, I'm Paul Shankman, StorySmart Video News.